We go now to our reporter Laura Windsor, who has more on chronic pain and how it affects the family.
Chronic pain is a health problem that not only affects the individual who is in pain, but also family members. We spoke with Dr. Peter Abaci at the Bay Area Pain and Wellness Center in Los Gatos, California, who tells us more.
So how does genetics and the environment play a role in controlling pain? Well, we know that there are two forces that come together, the genes that we inherit and the environment that we put them in, and that the way those two interplay have a lot to do with how we feel and function. While we can't necessarily control the genes that we inherit from our parents, we can do a lot of positive things with the environment that we live in, that we work in, that we sleep in, so that the genes that we do have will do well and succeed and help us manage our pain much more successfully. We've learned these lessons over many years with a lot of the patients that we've worked with. We create a very healthy wellness environment for them at the Bay Area Pain and Wellness Center, and they do great with that. But we know that if we send them from there back to a toxic environment at home or at work that's not supportive and not supporting them, we know things will fall apart. So it's really important to tend to your environment. Well, one of the things that we learn when people are in pain is that when someone's in pain, everybody's hurting at home. And recognizing that, and when that process starts to take place, people start to assume roles. One person might be the enabler, and they may, out of best intentions, wanting to be helpful and not want you to do things, not want you to hurt yourself or overdo things at home. But you know, sometimes that can get in the way of the person getting more active and more healthy again. So we want to identify those problems. Another person might be the ignorer and not know what to do. Another person might tend to be the hero in the family. We want to recognize where these things are starting to occur, identify them, and sort of reorganize the roles a little bit so that everybody's leading a balanced and healthy life.
How can someone better communicate with family members so they can manage their pain better?
Communication at home is critical when you're trying to work together with a pain problem. And there are many different ways we communicate. One is the words that we speak, but also when we're in pain, we communicate in other ways. Our body movements, our mechanics, we might grimace or limp when we're walking. The tone of our voice when we say things, we might have a tendency to come across as sounding angry or upset, and the person listening to us might think that we're upset with them when we're really not. We're just uncomfortable and in pain, and we happen to come across that way. So the way we say things, what we say, what we do with our bodies communicates a lot to the people who are living with us. Well, at the Bay Area Pain and Wellness Center, one thing that we've done that's been really successful for us is we have a class for families, for family members, a special class for them to come in and learn about what their spouse or their family member is going through so that they can better work together with them. And learning how to communicate with your spouse or your family member is really, really critical. Learning how to educate them as opposed to coming across as just complaining. Learning how to tell them about the positive things you're doing to get yourself better. Once that starts to happen, it becomes infectious, and then they want to do the same things you're doing. They want to go exercise with you. They want to do the same things that you're doing that's making you better. They want to participate, and then everybody wins and everybody gets involved.
Family members need to know how they can be helpful and what might be hurtful for someone with chronic pain. So open communication is crucial. For the American Health Journal, I'm Laura Windsor.